program. I'll actually start by touching on what you just said because it involves the entire family. I call it your toddler circle. Anyone in your toddler circle, sometimes there are grandparents there, babysitters, partners. It's not just the go-to parent, right? Everyone needs to be on the same page. We're all human and we view things differently. And so my goal is to train everyone in their toddler circle to learn the research-based strategies that I use in speech therapy, that all speech therapists go to school for, and how to implement them all day long with your toddler.
Hello, everyone. I'm your host, Dr. Shafer, on Talks with Dr. Shafer. I'm a physician, mom, life coach, musician, publisher, author, and I am passionate about storytelling as a tool to help you reclaim your story and build your most beautiful future. Today, I'm so excited to be joined by our special guest, Tala Hershey. Tala is a speech-language pathologist. She's the owner of Hershey Therapy Practice and Hershey Speech and Language Coaching, and as she tells us, most importantly, the mom of two beautiful young toddlers. Tala, thank you so much for joining us today and sharing your story.
Thank you so much for having me. I'm excited to chat.
Oh, me too. I've been really looking forward to this. Now, tell me, what brought you to a place where you wanted to pursue a career in speech therapy?
It's a very long-winded answer, but I guess the short answer is, like you, I'm a musician. I'm a trained singer, and I sort of found speech therapy through voice therapy when I was training as a singer, and found the field through there. But I sort of always knew that I was going to work with kids. I was that 12-year-old babysitter, always working with kids. That was always my passion. So I put two and two together and I figured I could always incorporate music into speech therapy. And so that's how I found speech therapy, and that's exactly what I do.
Oh, I love that. How do you incorporate? I love this. I incorporate music from my music career into my work, and it's so fun. And I write songs with my daughter, and we put it in her podcast and mine, make reels, and we have so much fun. Music is such a connector and such a great way to work through emotions and work through challenges. How are you using your skills and your background in music and having that vocal therapy when you were a vocalist? How are you applying that to speech therapy now?
Yeah, it actually manifests in a lot of different ways. So with the younger kids, I sing everything. I make up songs all day long about nothing. I walk around my house just singing to my boys constantly. I just think that music bridges so many gaps. So with the younger kids in speech therapy and learning language, I'm really singing a lot. We're playing the drums on things, trying to incorporate listening to music and using that as a motivator because kids love listening to music. With my older kids, I do some stuttering therapy in my private practice. And actually, stuttering therapy and voice therapy sometimes present pretty similarly in that you have to work on the arc of the sentence and some breath work and other strategies that I know from my singing background and that I teach to my older kids who are working on more fluency shaping strategies.
Very interesting. And
Yeah.
on a personal note, to take it back to, your role as a mom and singing at home, I'm curious to know how that goes with your kids. Because I can tell you, I sing all the time. And for the first few years of my children's lives, they did not want it for the most part. And then over time, as they got older, then they want it. Then they want to participate it. Then they love it. But at first they were like, oh, stop.
So my funniest story so I have a 1.5-year-old and a 3.5-year-old. And my 3.5-year-old loves playing in the car and he loves putting on music and putting on whatever. And we were borrowing my dad's car and my dad still has the CD that I made for college in his car. My 3.5-year-old knows how to put it on. He calls it Mommy's Songs and he listens to it. And I started singing along to it and he goes, "No, Mommy, you don't sing." And I was like, "But it is me. But that's me." So I agree. It's really hit or miss with my kids.
It's really funny when you just sing a line and you get shrieked at like you've done something really
Hmm.
horrible, and you're like, people used to pay me to do this.
I know. And my 1.5-year-old shakes his head, no. It's very funny.
It is. It is. But thankfully, our biggest critics are the ones that love us the most sometimes, like our children, we get it. But when you're at work, I imagine that the singing is really, like you mentioned, a connector, a bridge to help you communicate things that maybe otherwise neurodevelopmentally would be more difficult to convey to your patient.
Yeah, for sure. And it works very differently in speech therapy than at home. And I train a lot of parents to use music as that bridge to teach language to their toddlers. Not so much that their toddler is really going to pick up on the song, which they might if you repeat it enough, but filling in words is
Mm.
huge to learn language, the repetition of music, and that the arcs of music and the tones of music lend itself to what's called motherese, which is
Mm.
when you talk to your kids, it's that higher pitched tone that you use. Some people call it baby talk. It's not quite baby talk. It's the technical term is motherese, and that is shaped like music. And I think that's why a
Mm.
lot of kids respond to music the same way they respond to that type of speech.
Yeah, that's so beautiful. And poetry as
Yeah.
well. Do you utilize any kind of we say sing-songy type, very melodic poetry for kids that maybe are, sensitive to singing?
I honestly, I have not had very many kids who are sensitive to singing. I
Mm-hmm.
know that it's a big part of the field. I just personally have not worked with that population so much. And what I've done is use the beat of music in those situations. So not so much the tone, but rhythmic,
Mm-hmm. Mm-hmm.
which also lends itself to speech and just listening to music. Because a lot of the times, what I find with children who have difficulty with me singing or somebody else singing is that it's not the actual either music or the tone is not 100% correct and they can pick up on that. I
Mm.
do not have perfect pitch, so there might be something in there that triggers, right? And so I'll play
Mm.
the actual music or just use rhythms.
Yeah. And that's such a great point too, that when our kids are triggered by something to not personalize it, but really recognize that for them, there may be just something off that they're
Hmm.
experiencing. And some of us, especially when we're really young, are more rigid than others and will do better. We are catered to in that sense. And that will allow us to not waste energy on this is wrong, it's distracting me, and just kind of focus on the goal, which is helping them with their speech. So, how does someone who needs speech therapy, what is the typical avenue to reaching you? Is it through schools or through their parents? How are people usually finding you?
That's a really good question. There are a lot of avenues through speech therapy, which I actually think is a little bit confusing for parents. You can go, first of all, it depends what country you're in, right? So in the United States, you can go through your state and the state services. You can go through the school system. Sometimes the state works with the school system, so it's one and the same. You can go privately and find me. So like a quick Google search or on social media, you can find me. Word of mouth is a big one. There are a lot of different avenues, and it sort of depends what your child needs. And I think that that's really hard for parents because you don't know what you don't know, right?
Mm, exactly.
So either somebody told you, a friend, a family, a pediatrician, a doctor, your gut thinks that something is off. Or maybe you have a
Mm,
little bit of knowledge, but more often it's either your gut or somebody mentioned something to you. And then you start going down the rabbit hole of finding a speech therapist.
hmm.
So my goal is to educate parents on what it looks like, what to look for, and then how to navigate the system a little bit.
That's excellent because you see more traditional patients, but you also have a client coach relationship with people
Mhm.
depending upon what their needs are.
Exactly. So there is a time and a place for speech therapy, one-on-one individual sessions, and there's a time and a place for coaching. And coaching looks different than speech therapy. And what it is I coach parents of what's called late talkers. And late talkers are defined as toddlers between the ages of about 18 months to 3-ish, maybe a little bit younger than 3, who have really no concerns about receptive language. And receptive language is the understanding of language, understanding what's being asked of you, what is told to you, directions, all of that. Really no concerns there, but they're not really speaking yet, and they're not communicating yet. No social skills, difficulties. These are late talkers. And what I have found in my nearly decade of doing speech therapy is that the biggest change makers in speech therapy are parents. So whether you're in speech therapy or you're doing coaching, it's the parents that's going to make the difference. So with this specific population, late talkers, where parents want to really boost their toddler's language, they can do it at home with the right strategies, with the right tools, with the right support in place. And this looks different than speech therapy. Speech therapy, we think of you go for an hour a week or a half hour a week. Maybe you get an activity to do at home, which is great. Speech therapy coaching, so my coaching business is much more intensive. So it's 12 weeks of intensive training. You learn all the strategies that I use in speech therapy to implement with your toddler so that they're getting speech therapy 50 to 70 hours a week through you versus once a week through me with some carryover. And I think that the most important part of this coaching side for my program is that it's very hands-on. I meet with you every week. I review videos of you implementing the strategies. So there is just no way you're not learning these strategies. And something you mentioned before was if something wasn't working with a toddler, what do you do? Right? So there are a lot of programs, a lot of parents go on social media, they find what to do with their toddlers, and it's a really great start. But what happens if it doesn't work? What do you do? So that's where this program comes into play because I'm there. Every week I'm there to field those questions. That's the main difference between speech therapy sessions, which I do have to mention there is a time and place for. If there are more concerns, if there are different concerns, articulation, there are receptive language difficulties, more social skills. There are tons of other difficulties that lend itself to speech therapy sessions, one-to-one with a trained speech pathologist versus coaching, where I can teach the parents how to do this.
Yeah, that's amazing. And it makes such perfect sense. I visualize a flower, right? This like sweet little flower in a pot, and the environment, right? It's in this environment, it's having this malady, and we take it to the garden center and we water it there. And then we're like, okay, bye. Well, I did my watering, and it's like, okay, well, we watered it, yes, but the flower can't water itself, right? A 1 to a 3-year-old can't water itself. They can't
Yeah.
necessarily follow through on some things without having it patterned for them over and over and over again. I think, correct me if this is incorrect, but there may be things happening in the environment that maybe not hurting the child, but maybe not helping the situation. And if there's no acknowledgement of it or recognition of it, it's going to be a hindrance as well. So what a beautiful opportunity to make sure that the environment is optimized for dealing
Exactly.
with the speech challenge.
Yeah, so the way I speak to that is creating a language-rich environment. And it's exactly that, optimizing your environment. And it's not just your home, but anywhere you are with your toddler so that you have the strategies to implement everywhere to optimize every situation. It's not just, playing on the floor. It's you're busy parents, you have lives. It's waiting on the car line for pickup. It's the grocery store or the zoo or the play, however, wherever you bring your toddler, you now have these skills to boost their language. And that's the goal of coaching, which is a really incredible part of our field that I think more parents should probably take advantage of.
Yeah. Well, it's really interesting and great that you're out and being an advocate for this and informing people, because often an issue with something not being utilized is it's not understood. We don't know that it's a
Totally.
resource. So it's really important to get the information out there. Could you give listeners an example or maybe a few examples of the kind of problems that would lead to someone ending up in your office for an evaluation for assistance?
So I do have evaluations for these late talkers per se. And there we'll see what an evaluation does for listeners is it really breaks down where is the gap in language. And language is really an umbrella term. There's expressive language, which is their ability to actually communicate. And that doesn't just mean verbalizing, it means sign language, gestures, pointing, how are they communicating with you? It means receptive language, their understanding of what's being told of them, or to them rather, and their pragmatics. So those three modalities are looked at when somebody comes into my office for an evaluation. Now, I have parents come in because their toddlers aren't talking. We do an evaluation there. I have kids come in because they're hard to understand, right? They're not quite as intelligible as other kids in their age range. Maybe their teacher brought this up, or somebody at the school, or you just know that they're not quite as intelligible. Fluency and stuttering is another reason kids will come to my office for an evaluation. Once they hit preschool age, and the language difficulties get more in depth. So then it becomes more academic language rather than social language and using language to communicate your wants and needs. At that point, you're starting to get into phonological awareness. So do they know their letters and the sounds that the letters make? Can they recognize the letters, the numbers? Do they understand a story? So reading comprehension. When they start writing, what does that look like? Can they write certain letters? Are they able to attend to directions given to them and remember them and act on it? So these are skills, if you've never had an issue with them, you don't think about it. But something as simple as the teacher standing in front of the room, giving a direction, and then you need to process that direction, manipulate it in your head, and follow through with it, right? You and I might just do it, but there are a lot of children who may have difficulty with that. So when they come into my office, we break down where are these difficulties happening and then create goals from there.
Yeah, that's so helpful because there are so many different areas where there could be a potential need to meet. And without breaking it down and maybe just having an emotional response to it, because I imagine also some families may have an emotional response when they have this unexpected need for speech therapy. I imagine it's really important to try to avoid certain language from our part of how we address these issues so that the child is going to therapy with the open mindset for it and not feeling, shamed, because I think
Yeah,
not necessarily from parents, but they may experience some uncomfortable things when they have speech difficulties. And how can we support them and help also the people around them support them as well, who maybe don't understand what is driving the need?
exactly. The number one thing that I say to parents constantly is it is not your fault. When your child has a speech and language difficulty, it is not your fault. And as a parent, I probably wouldn't listen to that. And I know there are plenty of parents who probably won't either. But given the research and everything that's out there, it's not parents' fault. And the most important thing that we can do as therapists is work with the child's strengths. Every child has strengths, and that's where we start. It's not a lot of what I hear from parents who come into me from other evaluations or other avenues is, the report was really hard to read. because all the report says is they had difficulty with this and difficulty with this and difficulty with this, right? What's really important is to hone in on what is this child really good at? Because that's where we're going to build upon, right? Those are the skills we're going to take and bloom. And that's also probably what they're really interested in. So
Yeah.
a very important piece of this is not necessarily bringing the child in and drilling them with flashcards or, things that aren't interesting, because kids don't learn that way, right? So finding what their strengths are and having parents know that it really is not their fault and they can implement strategies to help. They can be
Yeah.
very involved.
That's so empowering for the parents and just so important. Anything we do in life, if we're coming at it from a place of shame and blame, we are just distracting ourselves from a place of progress, right? We can't really look and focus on progress if we're focused on shame and blame and perceived past issues. So I love focusing on, okay, what can we build up? What strengths can we focus on to build up these challenge areas? And also
Mm-hmm.
the brilliant focus on what is their interest, because those of us that have
Right.
young children, we need their buy-in.
Oh, yeah. That is a huge piece. And I tell parents all the time, you have to join them in their play, especially for this coaching program where I'm teaching parents how to implement these strategies. If they decide that their truck is now a rocket ship, you're going to outer space. You don't have a choice. Like, this is just what we're doing now. You have to join them in what they're doing to get that buy-in. That's a really good way of putting it. And it's true, because you can take some control at some point, but if they're not with you and you're not with them, they're going to go do something else. And that's typical
Exactly.
of any toddler.
Exactly. And I think something I'd be interested to hear your thoughts on when you're working, when you are trying to work with something specific. Let's say there was an exercise your speech therapist gave you to work on with your child, age appropriate expectations as to the duration of that effort before we
Mm-hmm.
say, okay, we're done with that for now. Now we're going to outer space. Or, now maybe I can continue to sneak this into the play, but I can't do this focused exercise because the attention level isn't there and I'm not helping. I might be hindering our progress if I keep on beating on this.
Right. And so I think an important note is the difference between where the child is at their level versus age appropriate. So I
Mm,
think that a lot of parents go in and say, my toddler is 2, they should have this many words, they should be focusing for X amount of time. Why aren't they doing that yet? Let's get them to focusing for 5 minutes on a toy, which is not actually age appropriate. I think it goes to the age of the toddler. So 2 years is about 2 to 3 minutes. All that to say, we have to find where the toddler is. Where is your child? If they can only attend for 20 seconds, you're going to work for 20 seconds and add 2 seconds. And then
mm.
maybe the next time you're going to try and add another 2 seconds. And you're going to build up the skills that they already have. So that's where that comes in. We're very focused on age appropriate and not where the toddler is at their level.
Yeah, absolutely. And being cognizant of that and meeting them where they are. Because if you take a step back and you think, okay, let's make it something easy to consider that we all have emotions. If we wake up and we're just having a really bad day and we can't get out of that, funk, right? We're just stuck in that feeling and we're trying our best, but it's not our favorite day. And then we walk into a room and we're expected to meet everyone where they are. We can't do that, right? Sometimes
Right.
we are just where we are. And it's when someone comes to us and sits beside us and says, hey, I see you. I see that
Mm-hmm.
you're struggling and this is hard and I'm going to sit with you through this, and how that makes us feel and opens us up. And then we might actually in 5 minutes be able to join the party because we really acknowledged how we felt and we were able to kind of like climb out of it, but we wouldn't have opened that door if we were forced through it. We wouldn't have gone in.
Exactly.
And it's the same. And I use that example because we can all we can all imagine a day we had like that, but not everyone has had a reason to have speech therapy. So it may be frustrating, and it may bring up some feelings of shame and guilt on the parent side or the caregiver side, and cloud their judgment of, no, in this moment, my only job is to just be here with you, give you
Mhm.
tools, but just be invested in you, not be invested in necessarily this skill.
Right, exactly. So something that's so important to teach parents is that everything is really done through play with their toddlers, because that's their only job in the world. Their only job is to play. I mean, such a great life, but it's true. And so we have to sort of take a step back from what we know as, right,
Mm,
learning to us is, I picture a classroom environment, right? Doing some drill work. You're actively learning. They're learning through play. And so these little things, these emotions that are so important to note, these teaching one word utterances, teaching some language is all through play. So back to what you said, if your toddler wakes up a little bit grumpy, we
mm,
all wake up grumpy. So take a step back and say, okay, you're allowed. I think that we also think that children are always supposed to just be happy and playing,
mm,
but there is a big, they're little humans, right? And they
mm,
have the same emotions and they might not know what they mean. So this goes with giving them the language to support those emotions. I see that you're feeling a little bit grumpy, or maybe you're feeling a little bit hungry. Are you frustrated by this? Did I frustrate you? Maybe we pushed them too far, right?
mm,
But now you're giving them the language for that. You're teaching them frustrated, grumpy, excited. Maybe they get really overexcited and a little bit dysregulated and they start running around, and you can say, you look really excited, and join them there. But we always have to join them where they are emotionally and their level for
mm.
language.
That's an amazing tool and an easy thing to do to kind of get out of our heads and into the moment.
Mm-hmm.
And that's the perfect starting place for connecting with them and helping them through whatever challenges you are trying to help them through, no matter how, challenging it may be. And thank goodness there are these tools. It's not all on the shoulder of the parents and the
Mm-hmm.
educators, that they do have these resources. There are wonderful speech therapists like yourself to provide the patient care and to provide the coaching. And circle back to what you said about coaching the family. It's just, I think in everything in life, especially with children from toddlers, infants to teenagers, is usually if there's a problem, it's the child is not the problem. There's an issue that needs to be really kind of holistically addressed, right? The environment needs to be addressed, the child's mindset, and there's also some, neurodevelopmental things that we may need to address, and not address from just that child's standpoint, but the system. Is the system
Mm-hmm.
meeting their needs? Is the family, do they have the tools they need to all communicate the best way they can? So I love that focus on the family and the environment to really just take it up a notch to make sure that you're meeting your children's needs. I'd love you to discuss with us your Tiny Talkers Toolkit, another resource for families that you have created.
Yes. So the Tiny Talkers Toolkit program, I'll actually start by touching on what you just said, because it involves the entire family. I call it your toddler circle. Anyone in your
Mm,
toddler circle, sometimes there are grandparents there, babysitters, partners. It's not just the go-to parent, right? Everyone needs to be on the same page, and that's what this program does. And a lot of times I'll have parents come to me where they're not quite on the same page about their toddler's language, and that's totally normal. We're all human and we view things differently. And so my goal is to train everyone in their toddler circle to learn the research-based strategies that I use in speech therapy, that all speech therapists go to school for, how to implement them all day long with your toddler. And the idea here is that you are able to give your toddler 50 to 70 hours, and obviously that's a rough estimate, but significantly more speech therapy than they would get just going to a speech therapy office or even having a speech therapist come to your home. It's a naturalistic environment because it's wherever you are. If you know these strategies, you can do them anywhere. So, like I mentioned before, you can do them stuck in traffic. You can use the time while they're in the bath or while they're eating. I could go on, but the goal of this program is to train parents and anyone in their toddler circle to learn these strategies with hands-on guidance. So I have coaching calls every week with parents. I'm answering questions. I'm troubleshooting. There are video reviews, so you can send me videos of you implementing these strategies and I'll give you feedback. That was great. Let's try this next time. Real in-time feedback. And the goal is it's a 12-week program, and in just a few weeks, you become an expert on how to boost your toddler's language, and you're seeing their communication evolve in just a few weeks because you're able to know these strategies.
That's so empowering, and I'm sure that that is just something that families are so grateful for as a resource. Tell our listeners where they can go to learn more about Tiny Talkers Toolkit and you.
Sure. So if you want to learn more about the program, you can go to HersheySpeechCoach.com, and it's an overview of the program, and you can book a call with me and we can talk more about the program. You can join my Facebook group, it's called the Tiny Talkers Toolkit program, teaching parents to boost their toddler's language. Seems to be a very long name, but that's the name. And actually in that group, there are a lot of resources on how to start boosting your toddler's language right at home today. So little tidbits that sort of scratch the surface of what it's like to be in the actual program. And my goal is to reach parents who are sitting on wait lists and don't want to wait anymore, who have been turned down because their toddler speech isn't, quote, bad enough, right? Or not severe enough, but something is still wrong. I've spoken to parents in other countries where they don't even evaluate speech until 3 years old. And so this developmental window of birth to 3, there's a reason early intervention is so important. And if parents can learn these strategies at home, it cuts out the middleman. It cuts out that waiting. It cuts out the guilt, the comparing your toddler to others, which we all do, even though we know we're not supposed to. And it just empowers parents. And that's really the whole goal of the program, is to give parents control of the situation.
That's wonderful. And providing those resources, because we all know basically every specialty that there aren't enough practitioners to provide service to everyone who needs it. So creating accessibility is huge, and trying to reach people during that window of the greatest opportunity is so important. Now, it doesn't mean that if you've missed that window, that you shouldn't pursue therapies. If we can work, our goal is to get everyone seen who needs to be seen, and then kind of keep rolling that back. And then, okay, can we get everyone who needs to be seen sooner, and just keep on working on creating a system where children have the resources that they need.
Exactly. And put parents in the driver's seat, because I think a lot of parents feel a little bit helpless if they don't know what to do, or they have gone on social media or the Google rabbit hole and they found strategies, but they're not really working. Yeah, it's to empower parents to seize this developmental window, this crucial window, and get their toddlers help.
You're doing amazing work. I want to give some scope to this issue so that it maybe normalizes this also for parents who may be just learning that this is going to be a challenge for their child, and they're thinking, oh my goodness, I can't believe this is something my child has to face. How common is it to need or to potentially benefit from the help of a speech therapist as a young child?
That's a really good question. It is actually quite common for children, and for differing reasons, to be late talkers. And so you do feel sort of on an island as a parent, right? You think my toddler is the only one at the playground who's not really talking, when in reality, many parents around you are also have concerns about their toddler. And so the other piece of this group is to create that community, to show that you're not alone. There are parents who are looking for help but don't know where to turn. And it is more common than they think. You don't need to be on an island. And if you have any concern at all, my recommendation is to reach out, because what I tell parents is something that you'll read online and on social media is, give them time. My toddler didn't start talking until 3.5 or 4, and now they don't stop talking. And you hear this all the time. But one, I don't think that that's very helpful for parents who are waking up every day hoping that today is the day that their toddler is going to start talking. And two, I tell parents, what's the worst that happens is you take control and give them a boost. That's it. That's the worst that happens. And so it is really crucial for parents to know that they are not on their own. They do not need to be on an island. There are tons and tons of parents just like them reaching out for therapy and help, but maybe it's not so normalized to talk about just yet.
Well, thank you for being a lifeboat and going out and helping people understand that they're not alone and understand that they are truly in a state of empowerment, that they really can make a difference, that they're not just sending their child for speech therapy, but they are an active and crucially necessary part of their child's development. And I think that is also a tool for buy-in from the family as well, so that everyone is doing their best and everyone feels their power, because sometimes we feel so out of control in these circumstances. Being able to focus on what we can do is so valuable.
Absolutely. And for parents to know that, yes, there is a learning curve to learning these strategies, but it should not be something extra that you're doing, right? It becomes ingrained in your everyday routine. So it's not something to just pile on. And you've mentioned parents feel out of control. And I think that having too many things to do drives that a lot as well. But this is a mind shift. That's what this is. But it's not an extra on their to-do list.
It's so important. And we talk about this in so many aspects. And I'm just so pleased that you were able to come on the show today and reach
Thank
listeners
you.
who are having this challenge and need support from a professional like yourself. So thank you so much.
Thank you very much for having me. It was such a nice talk.
It was my pleasure. And we mentioned your resources earlier in the episode. I will make sure that they are also in the show notes. So anyone who's listening and wants Tala Hershey's help is able to find her on her website to seek out clinical expertise, and the resources also in the Facebook group. They all sound amazing. Thank you so much for being here again. I really appreciate you. And listeners, I appreciate you too. Please, if you have any comments or questions, leave them under the episode in our YouTube channel. Feel free to contact me through my website, www.drshaferstudionova.com. And again, have a wonderful week. Stay safe and take care. I'll talk to you soon.